Welcome to part two of the very special edition of the Maximize Your Medicare Weekly. In this video, a special look at Medicare Advantage, what to look for in 2021. Coming up next. All right, it's the evening of October 1st, and I've had the day to answer tons of emails and make two presentations in public. Anyway, remember October 5th, that last moment reminder here. That's next Monday. Yep, this coming Monday. Registration link in the text of this video. Spaces are dangerously limited at this point. Once we hit capacity, I'm going to have to shut it down, and I will do so. I expect that to happen, today, tomorrow, something like that. In today's video, what I'm going to be talking about is Medicare Advantage. The reality is, last night I made a video, and there was a huge problem last night. Well, that has been sorted out at Medicare.gov, thankfully. I had hoped that they would be ready right at midnight. They weren't. They've, corrected it since, and it's pretty important in terms of calculating anticipated prices so that you can try to have any guess as far as the guide to what plans might be most fitting for you and your situation. What we're going to have is we're going to have a particular situation from Chicago, Illinois, but please know that the way that I go about doing this is going to apply to almost everyone who is checking out Medicare Advantage. And we're going to go through a lot of the different ideas that I put in Maximize Your Medicare. You can see it in action. The reality is do I think that you should do this without an expert? No. But I'm also not, there's nothing forcing you to call or send me an email, the email that's showing up on your screen now. Nothing stopping you from, trying to, but you'll see that the error rate and the number of mistakes that can be made are so large and can be so important that it's just better to be safe with something on a topic that's this vital. All right, let's get started. So what's up on your screen right now is, a report from Medicare.gov. You need to watch part one if you don't want to understand exactly how we got to this point, okay? What we did is we took a person in Cook County. Cook County is, Chicago, Illinois. We had the person with 5 prescriptions. They are lisinopril, albuterol, levothyroxine sodium, Restasis, and an insulin. Okay, those 5. We also then selected a number of pharmacies. Those pharmacies were Osco. So those are this is your drug list up here: albuterol, insulin, levothyroxine, lisinopril, Restasis. Yes, correct. I got it right. And then you hit done. And now we also chose these pharmacies: Osco, Walgreens, CVS, and mail order, because I just want to check how much that changes your prescription drug cost, because that will affect things. Here we go. Once we hit done, what happens is this report comes out. Now, under Medicare Advantage, even more so than under Part D, you need to be careful here. This sort order is sorting by lowest drug and premium cost. It is saying nothing. It is saying nothing about the cost of your health care services that you would receive in a year. It's not making any assumptions, none of it. This is a change from the past. It's a change from prior versions of Medicare.gov, not last year, but in other iterations, where they used to make estimate of an average amount of medical services. No such assumption here. It only takes into account prescription drug cost. You can see it comes out in order, and you can see what ends up happening. Here's your estimate of total prescription costs: $3,110. Okay, expensive stuff. You've got insulin here, American Advantage, and on it goes. And you can see what ends up happening. There are 52 plans available in Cook County. 52. That's a lot. Okay. Now, for persons on insulin, it's important here to go under here and filter plans. You see this box? Insulin savings? Click it. And you'll see it here. And then apply filters. You can see the number of plans that have insulin at $35 copays drops to only 8. Okay, so it's going to be up to you. And you can see then, now all of a sudden, what used to be this 50, more than 50, is now only 8. Only these 8 plans are giving you prescription insulin at $35 cap. Yeah, but you can see what happens here. The difference amongst these top set, 1, 2, 3, 4, 5, number 6. Look at the difference. $3,801 for your medications. $13,000. $10,000 difference from plan number 5 to plan number 6, 5th place to 6th place. This is why you got to be careful. You make an error in inputting or double checking, etc., etc. This is the type of error that can happen. You need to be careful. There's a reason that we run this for free for people, who just want to have assistance. What do we need to know here? Number one, whenever you're dealing with Medicare Advantage, I always tell persons the following things. Number one, you must understand the nature of the plan and the network. The network matters. You must understand what a PPO is versus an HMO. Very, very important, because PPO allows you to see doctors that are not in network but accept the federal Medicare card. Then you can be charged an out-of-network cost. At least you'll know that your plan will be accepted by that doctor as long as they accept federal Medicare. Under HMO, under most traditional HMOs, the answer to that is you cannot see persons outside the HMO. Otherwise, you bear and are responsible for 100% of the cost. Okay? There are a lot of moving parts in a Medicare Advantage plan. But that is the first one. The second one is you can see these different out-of-pocket maximums. That's what this number here is. Maximum you pay for health services. Wish my highlighting skills were better. There it is. Just to be very, very clear, these are the maximum amount you can pay for healthcare services, not for prescription services, not for prescription drug benefits, sorry. Only for healthcare services. Once you hit this number, then the carrier pays for the remainder. Okay, and you can see that it's $5,900 if you use only in-network. And you can see that if you use any combination of in and out of network, $6,700. So you're going to want to stay in network if at all possible. Look, I'm not saying that, that something unexpected couldn't happen. You could be referred to a specific specialist, 5 counties away, not belong to the network. That goes under the umbrella of things you can't control. I'm talking about the things you can control. Under HMO, you'll see a different number. A lower number you can see under in-network versus here, $5,900. You can see it notably lower, right? $2,000 lower. Yes, but here you can see this is in-network only. There's no number for in-network and out-of-network. Why? The reason is this particular plan only covers you in-network. you're responsible for 100% of the cost out of network. So you're going to want to be careful here. Now, we're going to continue to go on here, and you'll see different premiums, $76, and then back down to zero. But you can see that this thing isn't driven just by the premium, but by the total yearly drug and premium cost. Now, does this mean this plan is always inferior? No, not necessarily. And I'll tell you why. Because it entirely depended on the combination of medications and the plan. You cannot presume, well, this plan is, across the board for sure better out of those 8 plans that I showed you for Cook County for people on insulin. That may not be the case. There may be a different version of insulin that you're on and not just this insulin Lepro Junior Quick Pen. Okay? There can be a different type of insulin with a different copay, right? Which will yield vastly different results. So you can see, let's do one more thing. And you can see this is you up here at the top. You're viewing 2021 plans. Show me 2020 plans. Let's go to 2020 plans, shall we? Blah, blah, blah. Done adding drugs. Same drug list. Same pharmacies. Done. Now, let's see our list. Don't be worried about zero Medicare Advantage because this insulin savings program didn't exist last year, so we'll click off. And yes, back to 46, which is the number available in Cook County in 2020. Yeah. Well, look at the different sort order. Those plans that were there last year for 2021 look not, and look at the different yearly drug costs. You can see it can be worrisome. So let's just take a look at this particular plan. Let's just call it here. Same drug costs, same pharmacies. Sorry, same prescription, same pharmacies. This details all the different copays, co-insurance for different services. There are extra benefits. You can see it here. I'm going to go down to drug cost. You can see how dramatically lower. So first of all, the cost after deductible, $39. Pretty close to the $35. What does this tell you? This tells you that Medicare Advantage plans have already been giving these discounts for certain types of insulin to their policyholders. Okay? It tells you that. The list order is different, so the order would have stayed the same. You need to be careful. What this number does, and here's one of the things that I don't love about Medicare.gov in this instance. Well, there's a long list of stuff I don't like about Medicare.gov, but this one in particular. This yearly drug premium cost only is calculating for the remainder of this year. It's not calculating what would have happened if you had started in January. Okay. So the order will stay the same. But this number is not the annual number. This is the number for now to the rest of the year. So for example, if you turn 65 in November, this is your list of plans with that set of medications and that set of pharmacies in sort order of the lowest drug and premium cost, as you can see. Sound complicated? And actually, I've gone through the fast version, right? Because as I said at the beginning of this conversation, which is you need to check the network. You need to check out your doctors, hospitals, clinics. If you go and, if you go to some particular physical therapists, find out if they're in or out of network in order to lower your overall cost. There's no shortcut to that. In Medicare.gov, there's no way to vet the network. You're going to have to go one by one after narrowing it down to meet your criteria. you know, maybe I should give you a script. Maybe I should write it down. If you see these YouTube videos and say, okay, here's how to make a good video that gets to like 6 trillion subscribers, you polish it and stuff like that. I don't have the time for that. All right. So I don't use a script. But today you've got a downside, which is I forgot a pretty vital point here. When you're comparing, and it goes back to something about which one's better, Medicare Advantage or Medigap. Okay. And I'm gonna make it here. So this here are the Medicare Advantage plans available in Cook County. Let's take a deeper look here. The premium here is $0. Okay, and your total prescription costs are going to be somewhere around $3,000. All right. Let's take a look at standalone prescription drug plans alone, the Part D plans. And here's what I'm going to show you. There are 31 plans, but when I choose the filters for insulin savings, there we go. Apply filters. There are 9 plans. You can see, what do you see? You see that it's $900 more for a standalone prescription plan for the same list, for the same pharmacies. Nothing has changed. But your drug cost for standalone Part D is higher here when you compare it to a Medicare Advantage plan, and that's coming up, which, as you can see, is $3,000, more than $900 difference. Nothing changed. In addition to that, okay, we'll get to we're not at the punchline yet. If you have Part D, that probably means you have Medigap, right? You're in Illinois, Medigap can easily cost $150, or in Cook County, it can easily at some point cost $150. Let's just use that as a good round number. That's $1,800 a year. So under a Medigap plus Part D in Cook County, if you use this base case of Medigap at $150 a year, $1,800 plus $3,900. Okay, 18 plus 39, as far as I can tell, is $5,700, $5,700 is your Medigap premium plus your total drug cost. Under Medicare Advantage, what happens is it's $3,000. In other words, your total configuration is $2,700 more in premium, in total cost, sorry, because the premium Medicare Advantage is $0. Now, does this mean that Medicare, what has actually happened here? What in the world can explain $3,000 for Medicare Advantage plans versus, and you can see it here, $900 more for a Part D plan? Why? Because it has to do with the way that Medicare Advantage plans get set up. So let's say you're become a Medicare Advantage subscriber. What ends up happening is the federal government pays the carrier a per diem, an allowance, kind of like you give to your child. And the child then buys, trading cards, or I guess now, Pokemon cards, or, comic books, and, soda. What has clearly happened here is the Medicare Advantage carriers have taken some of their allowance and bolstered, enhanced the prescription side, which drives down your out-of-pocket costs. Now, that means they're taking it away from somewhere else. That's why this is not a simple exercise for persons. People ask me, Jay, just give me the simple answer, Medicare Advantage or Medigap. The reason I can't answer that question is because I'm not there to help, or no, I don't know you. I don't know how your financial situation is. I'm not sure how risk averse you are. To some households, look, the fact of the matter is I need to have every single dollar. Well, everybody does, but you understand my point, which means that every marginal dollar is groceries. Okay, guess what? That person, they've got to accept the risk. They have to have the lowest possible running cost. To other persons, they don't want moving parts. They could have a long list of other reasons. So go to the other video. I'm going to show you it up on the screen here. Medigap versus Medicare Advantage. There's a long list of reasons. It's an entirely different subject. But you can see here by this example that the math of money is as I suspected, which is that the per diem, the money is being used by Medicare Advantage plan carriers to enhance the prescription drug cost in order to attract people. And you can see it on this list of just 5 medications. You can imagine how different it can be if the list of medications is much, much longer. Tough stuff, for sure. All right. All right. That's enough video errors for today. Anyway, that's a wrap. Again, the email AEP2021@gh2benefits.com. Don't forget the virtual event, October 5th, just days away. I'll be talking about all the parts of Medicare. Be sure to leave your comments, like, and subscribe to the video. Thanks for watching. I'm Jay. This has been the Maximize Your Medicare Weekly here at the beginning of the Medicare annual election period. Speak with you next time.